It was interesting because my husband kept noticing that my sleep apnea was getting worse. And I thought, oh, do I have to go see the doctor and all these studies? I was really not interested in that. And then the website came through and it said what Dr. Nichols was doing. And I went, wow, is this amazing? It was like a week later, and I said, well, I need to investigate this. So I went and met with Dr. Nichols, and he went through the brochure. He told me about the procedure. And then when I went home, I showed it to my husband, who is a researcher. And so he researched for a couple hours. And after he looked it over, he said, this would be good. And he gave me the green light to do it. And I know when he researches things, he researches thoroughly. So I had the confidence that this is the route that I wanted to go. The major issue that I had was my sleep apnea, which I did not realize it was that bad, but my husband kept waking me up and stirring me, and so he was saying it was getting very, very bad. I knew that I was not sleeping through the night. I knew that I was constantly waking up. I did not necessarily know why, that it was my breathing. I just thought maybe it's stress or thyroid. I was thinking of all these different kind of reasons what I needed to address, and I knew I constantly had a drainage going down my one sinus, and so I thought, okay, well, it must be a dairy issue, and so I eliminated dairy and sugar in case it was a yeast infection. But constantly not having a good night's sleep was my major issue. I would wake up, my jaw would be clenched, and I was having those feelings of stress. So, and just not having a good night's sleep. Definitely lower energy, which I knew I wasn't sleeping through the night, and it wasn't a sound sleep. I always felt like I woke up not feeling rested, and then I had a full day of work, so I'd go off to work. Again, I thought, okay, it must be my thyroid, so I'm investigating all these different issues and trying to address them, but I still was dealing with the symptoms. It didn't even occur to me that I just needed some really good, strong night's sleep. Those were my major issues, the jaw clenching. The dentist even wanted me to put in the mouth guards at night because they saw that I was very tense and I was grinding my teeth. Then also the drainage. I was constantly having this drainage. I would say for a couple of years, I had a slight drainage constantly going down my sinus. And again, I thought it might be a yeast infection or so, and I was trying to take care of it with my diet. When I received the first treatment, I did not know what to expect. I knew intellectually what was going to happen. I think Dr. Jesse asked me, did you view any on YouTube and watch it done or anything? I said no. I said I didn't want to know. I didn't want to see. My husband said that this is what was good, and he kind of explained what would happen. And so I just went in cold, and yeah, it was unexpected, but it wasn't terrible. I mean, it was okay. I've never had that feeling before, but it was okay. Every time I went in, I kind of knew what to expect and just intellectually talked my way through it and said, okay, this is what's happening. We're dealing with the cause of what's going on. And so after my first treatment, I definitely felt my sinus open up. It was amazing how well I could breathe. I did not realize, I explained to Dr. Jesse, it was like having glasses for the first time. You did not realize how your eyes were compensating for what you couldn't see clearly. And I realized, wow, I've been breathing out of a quarter of my sinus, and that's probably what my issue was. And that very night, I had the best sleep I had in 2 years. So it definitely impacted my breathing. After the second session, I felt a lot of drainage coming. I've said I dealt with it for a couple of years. And so I thought, maybe it's like a floodgate opening up. And that's exactly what it was, because it was after a couple of days, all the drainage stopped. And I said, I have been doing this for 2 years, dealing with this, and now it was gone. That was just remarkable. I was just very impressed. Dr. Jesse, his personality is very warm, he's approachable, and what I told him, what I really appreciated is he talked through the entire procedure. I like to know what's going on, and so he would say, now this is what I'm going to do, and the balloon's going to go, and it's going to go into this cavity. So he walked me through it as he was doing it, and that gave me confidence. even though, when the balloon expands, you're not used to that feeling. But I knew it intellectually what was happening. And so I knew everything was fine. He is very intelligent. He's very knowledgeable, very confident about what he's doing, and very passionate. He loves to see the results and how a person is healed. That gets him so excited. He definitely has a desire to see people just recover. He's meant to do this for sure. Well, from my experience, it is so worth the process. It definitely changed my sleeping. I sleep so well now. I don't grind my teeth. I used to wake up and I could feel the tightness and just the strain. It was like I said, after the second treatment, I didn't even feel that anymore. I just woke up, I was relaxed. My neck muscles were relaxed. And I realized it was just from breathing well. The other aspect was exercising. Just exercising, breathing was so much easier, so I could exercise better. Again, I did not realize how my body was trying to compensate before. It was nice to be on a treadmill or to be working out and feeling like I had all the oxygen that my body could take, where before it was filtered or not having a full amount.
So if they're thinking about it but they're hesitant, would you say go for it?
Absolutely. If anyone is just hesitant about this procedure, I would highly recommend that they do, one, the research, and two, how much do they want to breathe better? Do you want to sleep better? Do you want to be able to enjoy a good night's sleep? Just the results of what I have felt, it's been life-changing for me, as well as for my husband. He's not waking up at night to wake me up because of the sleep apnea. He has said I've not had one issue since I started this treatment. So he's sleeping soundly also. I would highly recommend Dr. Jesse, as he treats the entire person with his chiropractic knowledge as well as the cranial facial release knowledge. When I would arrive, I had the adjustment, the chiropractic adjustment. He understands the whole body. He's not just treating the sinus cavity. He was treating the whole body. And so even after the treatment, he would understand everything that was going on with the whole cranial area, as well as my jaw movement. That was very important. I want to say he's the whole package in his knowledge, in his understanding, and in his passion, his demeanor. He helps you to be relaxed. And his confidence, is a big part of it. Everything put together makes him an incredible doctor as far as the craniofacial treatment, because it was not just one thing. He was treating the entire body. And so I think all of it blended together. I just highly recommend Dr. Jesse. It was an incredible experience. My husband trusted me in his practice, and that says a lot. So he felt very confident to have me in Dr. Jesse's hands.